So, Tom and Rachel Barker, thank you so much for coming on. And I'm delighted to meet you, but I'm sorry about the circumstances. Why are we having this discussion, obviously, about your daughter? Do you want to sort of tell us what happened?
Yeah, so at the end of January this year, Clara, out of the blue, turned quite yellow. She'd been previously well, other than childhood coughs and colds, but she was at nursery, and it started just with a bit of yellowing, just mainly around her groin area and a little bit of her eyes. And the GP was concerned. He said he thought it looked a bit like jaundice, but had never seen jaundice in a toddler before. It's quite common in babies, isn't it? And it's something that generally goes after a few days, but he'd never seen it in a toddler before. So it was straight to our emergency department where I sat with her for the whole rest of that day. Lots of blood tests, lots of different doctors coming in and out, scans, and it was quite clear at that stage that something was wrong, but no one really was saying anything. Didn't really have any explanation as to what was happening. We were given a bed at the Bristol Children's Hospital. And that evening, I think it was about 11 o'clock that night, I remember one of the doctors coming saying that they were already in talks with Birmingham Children's Hospital, which was is the specialist liver centre local to us, and we're in Bristol. And they were arranging for her to have a bed there the very next day. And it moved as quickly as that, really.
Yeah.
Mm-hmm. Yeah. Well, Rachel, what age was Clara at this time?
That's when it unfolded, really.
Yeah, well, what age was she when this
She'd just turned 2, so she was 2 in the December, and this was the end of January.
Mm-hmm, mm-hmm. And was she feeling unwell? Did she have a fever or anything, or was it mostly just the discoloration that you noticed?
There was no. She'd been well. I'd sent her to nursery that day. So I had no concerns as her mum that she was an unwell child. And even that day, sat in the emergency department, she was so good. It was such a long day. She was, constantly getting stabbed for bloods. And then she did kind of over the next few days, she deteriorated quite quickly, didn't she?
Yeah, she did.
But a lot of that was obviously, the trauma of all these different, medical professionals coming in and looking at her and trying to get cannulas in and taking bloods. It was constant. The blood tests were constant for the next couple of days. And then we finally, sat down with one of the consultants who had said that that basically it was liver failure.
So it's really beyond hepatitis.
No.
Yeah. So sorry, Rachel.
Yeah. So
we were told at the time that it was her liver had failed, and it was hepatitis, but we would probably never know the cause. It was just she was just very unlucky in that she'd got a virus that had attacked her liver.
I mean, there is speculation about the cause. This adeno-associated virus. Yeah.
That's right, and we have, so since then, this was obviously very early on, and obviously we all know a lot more now, and there's been a lot of research done over the last, over this year. So now we know, we have been told that they've tested her liver that was removed, and she was positive for the adenovirus.
She's positive for the adenovirus. We haven't got a confirmation about, I think they call it the AAV2. And ultimately she wasn't in the study that you published. She was the January, and the study was based on those kids from March. But in effect, I anticipate that she's part of that group. But that hasn't been formally confirmed. And to be quite honest, the feedback we got from the doctors is that it won't actually, to us as individuals, it won't make too much difference. The care would still be the same now post-transplant.
Yeah. The damage is already done, regardless of the cause, isn't it?
Exactly.
Sure.
Yeah. So Clara was a lockdown baby, really, was she? I mean, how old was she when the sort of lockdowns and the restrictions started?
Yeah. So she was born December 2019. So yeah, and then I was unfortunately quite unwell after I had Clara. So we essentially didn't really do much with her when she was a tiny baby, and then the March, obviously, we went into lockdown. So yes, she was. Although she did start nursery when she was 1, so she'd had a year of of nursery before she fell ill. But yes, there was a lot of, in those very early days, we were in a number of lockdowns.
Yeah,
I mean, we'll never know.
Her exposure as an individual was limited really to family, but unlike what's really published, I don't know if you can remember, but we still had a period where in the UK where we effectively locked the schools down, so nobody went to school. However, the nurseries are still open, and that was the point at which actually, when Clara started going to nursery, and she used to go to nursery 3 days a week, so she had a circle of friends, in the first year of her life. So the concept of her being truly isolated, actually, compared to us, she was more exposed than ourselves. Clearly with the same restrictions that had been implemented within nurseries.
Anyway, getting back to the timeline, she went from Bristol and you moved up to Birmingham to the specialist unit the day after that.
That's right, yeah.
Yeah.
And that's where we stayed until March.
Yeah.
So you were there January, February, March.
It was, again, all the tests... Yeah, January, February, March. I think at the end of March we came home. So we were told, I think it was the Wednesday we arrived in Birmingham. On the Friday, the consultants came and sat us down and said that they would be listing her for transplant, and she would go right to the top of the... it's called a super urgent list. So Clara would go right to the top of that list. And then... we waited 6 days.
A long 6 days.
For the for the liver.
So she had a few limitations on what liver she could have. Because it's based on, again, I'm not medical, but it's based on blood type, and also size, because she was very petite and obviously very young. So with livers, they have the opportunity to, what did they describe it as? But effectively they can cut it down. So she had a cut down liver of an adult's liver is what she got after the 6 days.
I mean, it goes without saying really that as parents, this is the most awful experience you can have, watching your child be ill like this and having to trust it to healthcare professionals. And parents watching will understand to some extent, but it's a terrible experience. And she had the transplant.
It's one of those. It's an experience whereby. Sorry, John.
No, please go on.
Sorry, just ultimately, you don't know. How can I put it? I can't really describe the experience, and nor can I. At the time, it was kind of out of body experience. It's not something that as parents you reconcile as a possibility. And clearly, once it happens to you, or if it happens to you, unfortunately, then you've got no option but to deal with it. Especially in those early days, even we didn't know much about livers, did we, Rachel? We're not medical at all, Understanding what the liver does and what the limitations of a liver are, and understanding that actually, in terms of organs, it's quite a niche organ in that actually, for other organs, they can kind of intervene with, for example, kidneys. They can do things like dialysis to sustain but with the liver, the clock was ticking for us.
Yeah, absolutely. So was she getting really quite sick while she was waiting for the transplant?
She was getting sicker, yes. So the day 6 came where we got the call, and we were in intensive care by that stage. I think a couple of days before we'd moved into intensive care. She'd started to become quite delirious. So I think the surgeons, they had quite a bit of to and fro in between them as to whether this was the right liver for her. They couldn't wait another day to see if a better one would come the next day. It had to be that day, because she had got very sick.
So the transplant was actually in January, was it?
The 2nd of the 2nd, it was.
Yeah, 2nd of February.
So February.
Right.
It was clear. Yeah, we were listed in January, but it didn't actually happen until February.
Yeah.
And presumably the surgery itself went...
so it went well. It went, as well as you would expect a surgery to go. It was we were told it would be about 8 hours, I think. And we were told in advance, because Clara is so small, and because it was an adult's liver, there was a chance that they would have to leave her abdomen open. And that was the case. So they left her abdomen open for a couple of days just to sort of wait for quite a lot of that swelling to go down. Yeah. Which then obviously meant she had to go back into theatre a couple of days later. But you know, they were happy. You know, the surgical team were very happy with how it went, and immediately and literally, you know, that night when we went to see her, you could already see the yellowing fading. It was that instant. She was obviously, you know, after surgery, she was obviously very bloated and had a lot of lines and a lot of drains. But straight away, you know, that yellow tinge that she'd developed already, you know, and then that, you know, probably over the next 24 hours, it was almost completely gone, wasn't it? And then we did have a few complications, so it wasn't by no means sort of plain sailing after the surgery. Which is why we were there a little while longer than we would have hoped, and then we had another admission to intensive care. She had a collapsed lung.
That's a complication
while we were still there.
Yeah. As a result of the surgery, actually, it was a complication that it probably escalated a little bit further than it needed to, but. And unfortunately, you know, collapsed lung, you know, it was actually quite risky. And at that point, she'd obviously been through significant surgery, and she started on immunosuppression. So clearly, at that point, any infection is risky, you know. And again, it was a return emotionally for us. It was a return to somewhere that was quite daunting, haunting. Yeah.
And how long after the operation was she like up and about and, you know, available for cuddles and things like that?
Gosh, I think I remember in intensive care once they removed a number of the lines, we were able to then kind of lift her out of bed with the kind of assistance of the intensive care nurses, because she still had a lot of drains and lines in, didn't she? So we were encouraged to do that. Maybe a couple of weeks after transplant.
Honestly, I think it was quite early where we could actually hold her, but you know, the practicalities of another line.
Made it quite, and we were quite obviously nervous because, you know, we just didn't want to.
But transitioning to using, you know, to walking actually probably wasn't that long, maybe in the order of 4 to 6 weeks.
Yeah, and I think, we tried to get her up and about when we went back to the ward, not knowing that her lung had collapsed.
Yeah.
So this, you know, this poor little girl's trying to learn to walk again whilst not being able to breathe. And then, so obviously it was back in intensive care, then back, you know, on her back again. So that all just took a little bit longer. Then when we did come back to the ward after intensive care, she had a drain in her side, and where they drained the fluid. But she was, you could tell then, we were kind of then on the road to recovery.
She was getting better.
She was much stronger the second.
Excellent.
And now, you know, she's running about now, and you know, she's full of energy. If it wasn't for her having the NG tube, you know, you would not know what had happened. You know, she is touch everything. You know, we're having a good period, and we know that there'll be blips. You know, we had a blood test the last week, and you know, there's been a few tweaks in her medication, but on the whole, things are looking okay, and things are relatively stable. But it is, you know, forever we will be worried when we have those blood tests, just in case.
I mean, you know, kind of going back to when we left hospital, it was, you know, you go through this experience that. I guess often in the scenario that we played out, you know, people have hereditary liver issues, and again, I'm not undermining that, but for us it was like we were dropped into it, went through all these things, and then we we weren't sent home, but clearly that's the objective. When you arrive in hospital, you want to get home. That's a success, isn't it? At the point at which we arrived home, you know, you've got this idea. We arrived with what we thought was a relatively well child, in that she was yellow, but actually other than that, she was active, and then when you arrive home, you've got what is she'd been through, you know, some really serious surgery, and on top of that, she's now immunosuppressed, and she's now vulnerable to things that you and I, as healthy, especially healthy adults, we're not. And as the guardians of that, you know, that was huge for us as parents.
We sheltered. We were asked to shelter for 3 months.
I think so. Yeah.
We probably did about 5 because we were just, you know, making those steps back out into, you know, the world again with this little girl was really hard. But you know, we have to. Clara was climbing the wall, you know, in the house. So we took the advantage of it being summer and, you know, just trying to slowly get her back out to the park, and, you know, me sort of being very aware of, you know, other children around and having, you know, maybe 10 minutes at the park and then 20 minutes the next time, and just gradually building it up from there. And thankfully she seems to have ridden the summer relatively well. I am quite nervous about what, you know, the next few months are going to bring with it, you know, with it being winter. We've all got our flu jabs on Saturday, so we're doing what we can, but I think, you know, these next few months will definitely we'll get ups and downs, I'm expecting.
And I think most people will understand that obviously Clara's got to be on immunosuppressing drugs for the rest of her life to stop rejection of the organ, but of course this also greatly interferes with the functioning of her immune system. This is the frightening aspect. Right. There's one disease that's particularly concerning you, isn't there, I believe?
Yeah, so that's chickenpox, and that was, we obviously had, when we were discharged from Birmingham, we had a huge chat with the specialist liver nurses there around, you know, what we would need to do as parents, what we would need to look out for, how we would administer our medicines, you know, a huge raft of information. But what they were, you know, very, very clear about was the risk of even her being exposed to chickenpox. You know, we don't even want to think about her getting it. You know, that really is life-threatening.
Yeah. Mm-hmm. Yeah.
An exposure is very serious. So yeah, again, you know, the minute she's not in any kind of childcare, but you know that has to happen at some point, and it will happen. So you know, educating ourselves fully, but also educating anywhere that she goes, any nursery, any school, you know, anywhere like that they, you know, have to be aware and understand the seriousness of chickenpox and how it can affect Clara.
The reality is that she's a young child, and you know, like again, most adults and probably most reviewers, you know, ultimately we get exposed to it, and especially in that early period of the first 4, 5, 6 years of your life, you know, you get exposed to it a number of times, especially in the UK. So the reality is, in the society, the community that we have, Clara will get exposed, and for us as parents, that's really quite nerve-wracking, because clearly we are, you know, we're going to be vigilant of it. So there are steps that we take, as Rachel suggests, but we have to accept, or at some point we have to accept that it's going to happen, and actually, you know, ultimately, it's well, we think if we were in other countries in the world, then that might not be so much of an issue.
Why is that, Tom?
On the basis that elsewhere in the world, and quite comprehensively, the chickenpox vaccine is available. Well, in the UK it's available, so you can pay for it privately. But one of the things about Clara is, because of her immunosuppression, she can't take live vaccines. She can take the, I guess they're called the dead ones, much like the ones with COVID ones. Yeah,
dead or attenuated, yeah.
So, you know, so she's got the flu one next weekend, for example. But the chickenpox one she can't have. So I knew nothing. To be honest, I knew nothing about the chickenpox vaccine, and I knew nothing about the risks of chickenpox, not only to Clara but to others before this exercise. I say exercise, maybe I'm underplaying it, but you know, before we
we're in the situation
we're in. And the part of the reason, part of the reason we're here today really is to create awareness of the chickenpox, the risk to chickenpox, and the vaccine itself. As we described, it's to Clara. It's how I sleep at night, if you will. I think Rachel, to some extent, is that part of our job as the guardians of Clara is to be vigilant of things like chickenpox, and if it's at school or whatever, we'll take her out of, or if she has a direct contact, we'll take her out of school and we'll tell the health care services. So that's and hopefully that's a mitigation to protect her. But the reality is that in the UK there's upwards of, there are depends on the numbers you look at, but there's around 25 deaths a year from chickenpox, and they aren't exclusively children with immunosuppression. And again, this was all new information for us after having a read around. So you start to question, why haven't we done this?
So if all the other kids were vaccinated, then Clara would clearly be protected because the other kids wouldn't be developing the chickenpox and spreading it.
And that's what we need. Yeah, and you're absolutely right, John. And in countries like the USA, where they implemented in the 1990s, that's effectively what's happened. In that, I was reading the CDC website the other day, and ultimately they were saying that they believe they've reduced cases in the US by greater than 3.5 million people, and per year, that is. And they reckon they've saved in the order of about 100 deaths per year. And that's through the idea, the concept of this community vaccination, in that everybody, it's rolled out alongside MMR, as I understand it. Anyway, I don't know if there's two main ways of rolling it out. In that it's a intravenous vaccination, but in the US and I think Australia, they put it alongside the MMR.
It's probably intramuscular, Tom. I think. It'd be intramuscular.
Sorry, apologies.
Yeah. Now, of course, the other thing is the chickenpox virus can lead to shingles, can't it, in later life? I've seen many people with in agony with shingles.
Yeah. So this is something that will forever be, something that we will have to be vigilant of. And obviously, once Clara gets older and becomes an adult, we'll have to educate her, and it's something she will constantly have to be aware of. That the risk doesn't go away once she becomes, 16. Like you said, it could be. She could be at work, and this could still be an issue for her, and she'll still have to go through the same route. It'll be an immediate call to the hospital. It'll be a hospital admission. This isn't just have a paracetamol and you'll be all right in a few days. It's we're talking hospital admissions. We're talking pumping her full of antivirals. It's and it isn't just, particularly when she's still so little, the fact that she's being given more medicine. It's the lasting effect of that. It's that ongoing trauma. It's being back in hospital. It's that taking her away from her routine. It's and that will have to happen every time she has an exposure to chickenpox.
So we've got an opportunity here, haven't we? We've got an opportunity here in that, for us anyway, is that if we can get the vaccine rolled out nationally, alongside something like the MMR, yes, we're not going to eradicate the virus. In that, clearly, if it's only nationally, that wouldn't happen. However, our opportunity is to surround Clara with people that won't be carrying the virus.
Yeah.
And that's effectively what we're trying to promote.
How are you trying to promote this?
It's a vaccine that's available.
Yeah. I mean.
So how are we trying to promote it? What
political interest or anything?
So, in terms of, I think we've got this. Effectively, sorry, John, I don't fully know the full details, but we have the. What to call that? What's the name of the joint
Is it a joint vaccine and immunisation?
The joint committees for vaccination, immunisation and immunisation. Yeah. Are they considering this?
They are considering it. So the minutes are available online, and it's on their regular agenda that they have 4 times a year or 3 times a year. And I think they're doing some studies with Oxford University in terms of looking at the numbers associated with the rollout of a vaccine. So there's effectively they've got to do calculations based on the cost and burden to the NHS. So I think that's part of the study. I think about getting the source data to provide that study in terms of what's the benefit for the community in the NHS and what's the disbenefit. And we're hoping that in the next 12 months, 24 months, it can be approved and effectively handed to government as an advisory step to be rolled out.
Yeah. So it's not going to be a short-term immediate benefit to Clara. This is for the next year or 2 or 3, hopefully. I think what makes me slightly optimistic is the development of better antivirals. So if Clara does get a viral infection in the future, better antivirals will be able to eliminate that infection, we would hope, at a much earlier stage. And that would reduce the risk of these intercurrent viral infections. I mean, I think that's a big hope. And further modification of immunosuppressing therapy as well. More modern immunosuppressants.
So, we're hoping, obviously... Yeah. She's going to be on these drugs for life now, but who knows in 10 years' time what she's taking now? I expect it probably will change. There's, like you said, there's constant research. There's always developments that are happening, but what will not change is that Clara will be immunosuppressed for the rest of her life. That will not change, and she will always need some sort of medication to combat that. That will always be a challenge for her and for us. So whatever we can do to make her life a little bit easier, obviously we will.
Of course, but for now, most days she's having a happy childhood at the moment. She's out, she's playing. I mean, I've seen the video. She looks great.
Yeah,
she's
she's doing well.
I mean, this summer we've managed to get her to interact with other kids. And ultimately that's the goal. That's what that's a massive reward from life, isn't it? Spending it with others. The safest place for Clara is really not to really interact, but the reality is
it's not realistic,
she has to have a life. And it's been amazing for her to spend time with friends recently. And ultimately the goal is to get her to school, and as you said there about the antivirals, I'm sure that will play a part in her life. And she's already had a fair dose of them already, to be honest. But there's a long and full life available there for her. She's just got to take extra precautions or be extra vigilant, and hopefully she can. She can continue growing as she is at the moment.
Yep. So let's hope the JVCI are watching and encouraging the chickenpox vaccine. Maybe some friendly politicians as well. Generally, more public interest and understanding of this can only be a good thing. I mean, it's so good of you both to come on and talk about this. I mean, clearly remarkably difficult, and it goes without saying that we wish Clara the best possible outcome, as does everyone that's watching this video, and I'm sure many people in the comments will be saying that as well. So thank you both really very, very much for coming on. We really appreciate it, and we'll
thank you.
Cheers, John. Thank you.
And do feel free to keep us informed, whatever you think is appropriate. So
sure. Thank you so much.
All the best for Clara, absolutely. Okay, thank you both.
Thank you.
Thank you.
Okay.